American Health Front is a presentation of Medical Media Group and the following physicians and healthcare organizations.
Today on the American Health Front, most children can tolerate dental treatments or oral surgery, but some children may need sedation or general anesthesia. We'll learn why it's very important to find a specialist in this field. So please stay with us as we explore why we should have our wisdom teeth removed. Plus, most of us associate physical therapy with an injury or surgery. We'll introduce you to a unique physical therapy practice that goes far beyond that. Hello everyone, I'm Ernie Bjorkman. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special New York edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare. Dental caries is one of the most common diseases of childhood, affecting more than 40% of children in the United States. The majority of children receiving dental care for dental caries or for other reasons are able to tolerate treatment without the use of sedation. However, some children will require sedation or even general anesthesia in order to receive treatment. General anesthesia has proven to be a safe and successful way to treat dental caries, especially when performed by specialists in the field. Having performed thousands of successful oral and dental surgeries using general anesthesia, Dr. Ilan Kaufman is recognized by his peers as one of the most experienced dentists in the field.
The proper candidates for general anesthesia are typically young patients, some with complex medical problems, and also children with special needs. Many of these patients require extensive treatment and will not tolerate certain procedures without sedation.
Dr. Kaufman is a diplomate of the American Board of Pediatric Dentistry and a fellow of the American Academy of Pediatric Dentistry. For almost 15 years, Dr. Kaufman has served as Chief of Pediatric Dentistry and Dental Surgery at St. Luke's, Roosevelt, and Coney Island hospitals in New York City.
The advantage of having worked in a hospital setting for so many years is that I know we can handle even the most complicated cases. And our accredited facility allows me to take care of my patients in the safest manner possible. What distinguishes our facility is our fully accredited ambulatory surgery center, which is state-of-the-art and located on site.
Kaufman Children's Dental Hospital is in fact the first of its kind. Accredited by the American Association for Accreditation of Ambulatory Surgery Facilities, they have exceeded the required safety measures required by the American Dental Association. The highly accredited operating suite is an important feature of the dental hospital. However, Dr. Kaufman mostly performs routine dentistry without the use of sedation.
Our goal is to treat every child in the safest, least invasive manner possible. We make every attempt to use our best judgment in determining which children will require sedation.
Dealing with the behavior of young and at times frightened children is an area that is unique to pediatric dentistry. It requires an understanding of child psychology and knowing when the use of sedation is in the best interest of the child and their family.
There's something very special about providing care for children. It's clear to our entire team. We are making a positive impact on a whole family. It's an amazing feeling.
If you'd like more information about anything featured on today's program, or if you miss any of the important numbers that will be shown throughout our program, please call 1-800-984-2010.
Hearing loss can strike anyone of any age, at any time.
Well, when I was 4 years old, I lost my hearing to a disease called spinal meningitis. And for 38 years, I wasn't able to hear out of my right ear.
Single-sided deafness, commonly referred to as SSD, means a person is deaf in only one ear. The good news is that Dr. Anthony DeGennaro and the team at Atlantic ENT Group offer a solution for SSD called the Cochlear Baha system, which enables patients to hear from both sides.
The Baha system is the first osseointegrated hearing system that is able to restore hearing specifically for patients that have a single-sided deafness. Patients that are candidates for this are patients that have had chronic ear disease, cholesteatoma, single-sided deafness, or what we call a mixed hearing loss, where they have some conductive damage to the ear and some sensory neural or nerve damage to the ear. Now with this device, we can take a patient that's totally deaf in one ear and has one good ear, and by installing a 4mm implant behind the ear, which is cosmetically hidden, these patients wear this device and are able to hear by sound being transmitted through the bone, integrated into the titanium implant, and it routes it to the good ear.
Treatment is not one size fits all. That's why Atlantic ENT Group offers a personalized program for every patient.
When the patient comes in, we put the processor on, and we run a few tests with the processor on, and we are able to program the processor to the patient's needs and their likes, and make any adjustments that we need to make.
Just as no two stories of hearing loss are the same, neither are the stories of overcoming it.
When I hug people now, people are on my right side and they whisper something in my ear, I can finally hear them. So it brings me to tears, and I hold people really tight now when I do hug them.
Atlantic ENT Group, where it's not just about hearing, it's about enhancing your connection with life. By the age of 18, most people have 32 teeth, and each tooth has a specific job to do. The wisdom teeth, or third molars, are the last to erupt. Our mouth only has room for 28 teeth. So these extra 4 teeth can create problems, and most of the time will need to be removed. Oral and maxillofacial surgeon Dr. Sar Amrani of Kings Highway Oral and Maxillofacial Surgery tells us about wisdom teeth and why it's so important to have them removed.
Wisdom teeth are the third molars, known as the third molars. They're the last teeth to erupt into the mouth. That happens sometime between the ages of 15 and 18. When wisdom teeth erupt into the mouth, there isn't enough room for them to come into their desired location, because in a lot of instances the jaws have stopped growing to accommodate the space required for the wisdom tooth eruption. When this happens, the wisdom teeth can get trapped in an anatomical position that's not favorable for patients. This leads to trapping of food particles and plaque, bacteria in essence. The inability to clean this area causes an inflammatory response, which leads to pain, swelling, and abscesses, and even cavities to form on the wisdom teeth and the teeth in front of them. Traditionally, a great age to have your wisdom teeth removed is somewhere between the ages of 15 and 20. The whole procedure takes roughly 45 minutes to an hour in the office, whether a patient's going to have it done under local anesthesia, which is just the traditional shots type way, or with some sort of sedation or general anesthetic. This is available for patients to provide them with comfort and decrease their anxiety level during their procedure.
I'm not gonna lie, I had a little bit of swelling, but it only lasted a couple of days, but overall my experience wasn't bad at all. I didn't have a lot of pain, I didn't have chipmunk cheeks, so it was okay.
Kings Highway Oral and Maxillofacial Surgery, committed to surgical excellence and superior patient care. Today, many people are on a quest to live healthier, more active lifestyles. But sometimes injuries, wear and tear on our bodies, or even arthritis can interfere with our goals. The good news is, if you do develop problems or concerns, new surgical techniques and technology have redefined orthopedic treatments, giving patients of all ages incredible options. But finding the right team of highly trained specialists is equally important. The highly skilled team at Hudson Valley Bone and Joint Surgeons are dedicated to state-of-the-art, minimally invasive surgical and non-surgical advancements. Board-certified orthopedists Dr. Anthony Medallo and Dr. Greg Cavalieri tell us about innovative choices in orthopedic care.
Here at Hudson Valley Bone and Joint Surgeons, we treat a variety of musculoskeletal injuries and sports injuries, both acute and chronic.
Now let's find out what makes Hudson Valley Bone and Joint Surgeons unique.
Some of the things that make our practice stand out are the fact that we offer hands-on, face-to-face appointments with the doctor. Our patients do not have to go through a phone menu. They can speak directly to a person. And the way our practice is structured, we assist each other on surgeries, and our patients get the luxury of having 2 orthopedic surgeons. Also, we have experience treating professional, semi-professional, and Division I college athletes.
We primarily do minimally invasive arthroscopic techniques for most of our shoulder, elbow, knee, and ankle injuries. We also do ultrasound-guided injections for more accurate placement of needles for diagnostic and therapeutic purposes, including PRP.
The doctors came highly recommended, Dr. Medallo and Dr. Cavalieri.
I feel very relieved that it's all over with, and the doctor came and explained everything to us, and everything looks fine.
Hudson Valley Bone and Joint Surgeons, helping you stay active and return to your optimal performance. Most of us connect physical therapy to a treatment plan after an injury or surgery. The exceptionally trained team at Professional Physical Therapy goes far beyond that to help their patients lead active lives by combining years of experience in state-of-the-art physical therapy treatment with continuous education.
I think what makes this company unique is that we have geographical diversity. We have 23 locations in the New York metropolitan area. And my partners and I, when we started this company, we wanted to provide individualized care using state-of-the-art techniques for great clinical outcomes for our patients. In addition to our post-operative patients, we see a lot of weekend warriors that come in through our program of Direct Access. Direct Access allows the physical therapist to evaluate and treat a patient for 10 visits over a 30-day period of time. We utilize our techniques and our skills with these patients, and after a few visits, or if some cases are very severe or in the elderly, we recommend that the patient see their physician immediately.
The key to a successful physical therapy treatment is a commitment between the patient and physical therapist.
Some of the conditions we may see with our weekend warriors would include ankle sprains and hamstring strains. The techniques we would utilize to treat these athletes would be modalities or hands-on manual techniques or movement techniques and exercise for strengthening. Physical therapy is very important for these patients because it accelerates the process of them healing and returning to their weekend activities. We also provide them with preventative programs so that when they perform their home exercises and the exercises upon discharge, that the incidence of this injury from reoccurring is reduced. Professional physical therapy always strives to provide the best care possible and to do the best we can for our patients.
Over the course of training for the New York City Marathon, I developed a lot of knee pain. And so professional physical therapy really taught me the importance of strengthening and stretching all of those important muscles while still being able to train at high mileage.
Professional physical therapy, treatment as unique as you. Your smile is a big part of who you are, and a beautiful smile can say a lot. So never underestimate the power of your smile, not just the beauty of it, but the key role it plays in your confidence and overall health. We all want a beautiful smile, but a healthy smile is just as important. Dr. Jared Eisen has trained with some of the nation's top clinicians in all areas of dentistry. He is known throughout the metropolitan area for his expertise in cosmetic and restorative dentistry. Dr. Eisen and his highly trained team at New York and New Jersey Cosmetic and Restorative Dentistry combine their expertise and dedication with high-tech dentistry to give you not only a beautiful smile, but a healthy smile.
A lot of patients will walk in with problems with their smile, whether they don't smile at all, the discoloration of the teeth, the shape, the size. Most of those things can be corrected pretty easily and pretty quickly.
Now let's explore how they create unique custom-designed smiles for their patients.
We offer a wide range of treatments, from veneers to bondings to Invisalign, which is orthodontically straightening their teeth out. We have drills that are essentially silent. They make almost no noise, which to me and the patient is one of the biggest things. While my advanced technology goes on behind the scenes, the sterilization that I have in this office is as good as it gets. We make no compromises on that. We would strive here to exceed my patients' expectations. They come to me for all sorts of reasons, whether it's to fix dentistry done elsewhere or just to have a complete smile makeover, for them to have the confidence in me and my staff. We just want to blow them out of the water. One of my favorite things is after the first appointment, when I sit the patient up in the chair and I hand them the mirror. And I know what their response is, but when they look at the mirror and to see it in their eyes and to hear them say, wow, it's amazing, it's awesome.
New York and New Jersey Cosmetic and Restorative Dentistry, where your healthy, beautiful smile says it all. Millions of Americans are missing teeth, which can affect their confidence as well as cause problems in their daily life. Recreating the function and look of natural teeth can be difficult. Dental implants are the best option to restore your smile and improve the shape of your face. The doctors at the Randolph Center for Oral and Maxillofacial Surgery tell us why dental implants are the best permanent solution to missing teeth and how they are changing people's lives.
Statistics show that 69% of adults between ages 35 and 44 have lost at least one permanent tooth due to an accident, tooth decay, gum disease, or genetics. Most people don't consider this critical, but loss of teeth over the long term can adversely affect your general health, your self-esteem, and your general quality of life.
Dental implants function so much like your natural teeth, you might even forget that you lost a tooth.
Dental implants simulate the root of our natural teeth. Our body has a unique ability to adhere to the surface of the titanium layer of dental implants. Because of that, implants can support teeth that are fixed or are placed permanently in your mouth, and they can also support removable teeth such as dentures.
from somebody who loses a front tooth in an accident, where we'll actually take the root of the tooth out and we'll replace that tooth immediately with an implant, send them to a restorative dentist, and that dentist will replace that tooth with that implant and put a temporary crown on immediately. We can do restorations where the implants are placed, for example, in the lower jaw where the person has no teeth, and the denture can snap in and out.
This is a place to come because I felt confident, great, wasn't afraid, and I was the one that said, let's get it going, because I knew I was in good hands.
Randolph Center for Oral and Maxillofacial Surgery take pride in creating beautiful smiles and changing lives. Do you snore? Do you know someone who snores? Snoring is not a normal part of life. There are millions of men, women, and children in the U.S. who snore and have sleep-disordered breathing, or OSA, obstructive sleep apnea, which is a serious health problem. Now, if you've been diagnosed with OSA and traditional CPAP therapy does not work for you or is not an option, there is another treatment choice that works. Member of the Academy of Dental Sleep Medicine, Dr. Curtis Rindfleisch of Bronxville Dental offers oral appliance therapy, a simple and non-invasive treatment that might be your answer to better sleep.
Obstructive sleep apnea is basically when you stop breathing while you're sleeping. Your tongue is going to the back of your throat and it's closing your air pipe. Now, there are several different types. There's mild, moderate, and severe. The CPAP machine is the most successful appliance out there. About 60 to 63% of the patients are not compliant with their CPAP machine.
The first week I had it, I put the mask on and I went to roll over, and I guess the hose got wrapped up and it ended up on the floor, broken, $2,500 device.
FDA-approved oral appliances, which are similar to a mouth guard, have proven to be an effective treatment option for snoring and sleep apnea.
And the way they primarily work is they bring your lower jaw forward, and that